and I want to begin by echoing the thanks to the Honourable Lady for Twickenham for bringing this debate forward and her excellent exposition of the challenges that we face. Maintaining the good health of our children and young people is a challenge, and how much more so in the wake of COVID-19, with all the destruction and disruption it has wreaked on young lives and plagued them with fear and uncertainty during their formative years. Tackling this has to be a public priority, and it is so for the Scottish Government, and I hope the Minister will agree that it will be a public priority in England as well. Indeed, Scotland was the first nation of the UK to create the post of a dedicated Minister for Mental Health. And it's true that young people's mental health was a challenge, even before the COVID pandemic, but we all need to try to more fully understand the mental health and wellbeing impact of lockdown and school closures for children and young people, in order that we can be better informed about how to support them and what support can be offered as lockdown eases. It's perhaps obvious that feelings of anxiety and worry have developed in many young people throughout lockdown, and perhaps especially for those children who live in families who had parents who were key workers. And we often forget, I think, that the children of key workers during the pandemic will have undergone, undoubtedly, worry about their parents and perhaps other family members being on the front line during this pandemic. And whilst young people are off school and worrying, this worry is likely to have been magnified and exacerbated, as their key worker parents may well have been working longer hours than usual on the front line to benefit wider society. And it's worth mentioning that those living in disadvantaged communities are more likely to have had negative impacts on their mental health during lockdown. But many young people across the board also have been concerned about returning to school, missing out on school, and worries about the future. We know lockdown has been particularly difficult for young people who face challenges with digital access, physical space, or insufficient support with their home learning. And the lack of contact with peers, which is particularly important for children and young people. And there's no denying that there's a link between poverty and poor mental health, as well as poor physical health. And that is true for young people as it is for adults. So tackling inequality must be part of any long-term strategy to improve mental health. And the Scottish Government has established a range of measures to reduce inequality, but the real levers to tackle inequality, the ingrained inequality of which we're all aware, is reserved to the UK Government. Local authorities have reported increased self-harming and suicidal feelings, with an increased number of suicide attempts amongst care leavers. And recent studies show that 67% of young people surveyed believe that the pandemic will have a long-term negative effect on their mental health. Now, that is pretty shocking, but I don't think the long-term effects, mental health adverse effects, are inevitable. I sincerely hope that they are not, but hope, sadly, is not enough. There has to be a determined, decisive political will to tackle this problem. Now, the Scottish Government's approach is to focus on further investment in and redesign of child and adult mental health services, and the Mental Health Transition and Recovery Plan is supported by an additional £120 million to transform services, with a renewed focus on prevention and early intervention. The additional demand for mental health support in the wake of COVID poses real challenges across the UK, but these are challenges that we have to meet, and there's no dressing up. There's no getting away from it. We know in Scotland and across the UK, the waiting lists for mental health support are simply too long. And that is why the Scottish Government is redoubling its efforts to ensure that these come down, and they're working closely with health boards to that end. The Scottish Government is also working hard to ensure our schools are as equipped as they can be to support children. And that is why the £20 million additional investment in the Pupil Equity Fund, bringing that fund to almost £147 million, is so important for supporting children and young people from the most disadvantaged backgrounds. This fund resources educational psychologists, homeschool worker links and mental health counsellors. In addition, the investment in raising attainment and supporting the wellbeing of pupils is complemented by a £20 million summer programme, alongside a range of other investments in youth work, outdoor learning and Educational Scotland to support schools with the resources they need to strengthen mental health support. Indeed, the Scottish Government's £262.2 million budget for mental health and autism in 2021-22 is over and above the NHS spending and more than double compared to the previous year. And suicide prevention spending has also been doubled. But the member for Bath is absolutely correct. Psychiatrists are warning of, and I quote, a tsunami of eating disorders patients which are thought to be as a direct consequence of the isolation and feeling out of control engendered during the pandemic. But the mental health pandemic, which has followed so hard on the heels of the health pandemic, will require ongoing determined action across the UK. The explosion of mental health challenges created by the health pandemic will take time to treat and time for those suffering to recover. As long as we have the political will to do this, to give it the priority it needs, that is what matters. The reality is, we still don't yet know the full picture of the impact, the mental health impact of COVID-19, and we may not know that full picture for some time to come. However, a glimmer of hope can be found in the fact that now people are more willing, more able to talk openly about their mental health, which is a real culture change, even from as recently as a decade ago. That means that young people today are more likely to ask for help or talk to someone they trust if they are struggling, and that has to be welcomed. But we know, Mr. Chair, that talk is not enough. We need action, and the focus we now have on the importance of mental health must not be lost. Young people and children who have mental health needs require support, and they deserve our support, and we have a duty to provide that. The Scottish Government is working hard to do this, and I hope to hear that the Minister will be doing the same in her role.